Hello, everyone that's watching us on Facebook. This is Hussein M from WhatsApp Media Network. Today, it's another episode of Community Corner. This is a special show that we just introduced 2 weeks ago. Was the first episode we hosted Chief Haddad and Dr. Glenn Maleko from Dearborn Public Schools. This is the second episode, and today our guest, we are very honored to basically welcome with us today State Rep.Abdullah H Hammoud from the 15th District in Michigan. We're going to be talking about different issues and different topics that relates to you, relates to our city, and relates to our state. Whether it's infrastructure, whether it's insurance rates, school funding, anything that you guys want to talk about, we're going to be talking about today. There is 5 areas that we're going to be focusing on. However, if you have any question outside of those areas, feel free to write it in the comment box under this live stream, or feel free to inbox it to us. We'll be able to try our best to basically ask Abdullah Hammoud about it. State Rep.Abdullah H Hammoud. واللي عنده ذاك in the beginning of the show, I want to thank our sponsors for their continuous support. Our sponsors are Hamid Dakrub, Attorney Hamid Dakrub, State Planning and Probate Attorney, Applied Modern Health, Dr. Mo Hazimi, Big Rays Kutlub, and Oakman and Ford. Can you put it on silent, Afaf? في له وحدة على الجنب حطيها silent. And then Ever Fresh Market, be Dearborn Heights. So this is our sponsors. Anybody who's interested in advertising or sponsoring a show on WhatsApp Media Network, feel free to call us at 313-258-6799. Okay. Just before we start the show, I want to welcome Abdullah, and we're going to introduce him very shortly. I want to welcome the panel that's with us today. They are a community/media panel. We do not necessarily support or agree with their questions or opinions, but everyone is free to basically ask the question and express any opinion that you want. But we don't necessarily support it or agree with it. The other thing I want to mention is basically that WhatsApp is an independent and fact-checked web TV that broadcasts different shows, programs, and news reports and stories from Dearborn, Michigan, and the world. Abdullah, welcome to the show.
Thank you so much for having me. Honored to be here.
Habibi, thank you for always agreeing to basically appear with WhatsApp Media Network.
Whenever I can.
Since we started on day one, you were one of our first guests.
No, I remember the videos. Thank you for having such an interesting panel today.
Abdullah, could you introduce yourself to our viewers on Facebook?
Yeah, my name is Abdullah Hammoud. I have the distinct honor and privilege of serving as the state representative for Michigan's 15th district, which is largely comprised of Dearborn. Aside from the title, I am born and raised in the city of Dearborn, the second oldest of 5, 2 parents of immigrants. Fortune Tractor, I like to say that wherever I go. Woodworth Hornet, McDonald's Panther, very proud. And other than that, I'm just an individual who's from this community, for this community. Been involved in the community for many years, and I see my position as nothing more than just having a bigger platform to do what I, alongside many members in our community, already do.
Very
so
good.
Thank you for having me.
Thank you, Abdullah. We're going to introduce our panel. If anybody take the mic, introduce yourself very shortly. Introduce your name, which media platform you come from, and very briefly. It's already on, Zack.
Go ahead, Khodr.
Go ahead.
Good evening, guys. Hussein, thank you for having us. Abdullah, thank you for being here. And I thank all my fellow panel members. My name is Khodr Farhat. I'm a community member. I live in Dearborn, and I'm honored to be here. Thank you for having me.
Akram.
Good evening, everyone. My name is Akram Ali. I'm the publisher of the Free Opinion Press, and I really would like to thank Hussein for inviting me here to be. That is the great panel. And that's all. Thank you. Thank you so much.
My name is Zack Haidar. I'm always supportive of my friend Hussein, and when he told me that you're going to be Abdullah in the show, I was looking forward to see you again and meet with you and pick your brain and go through some of the issues that our community is asking for.
Awesome. Looking forward to it.
Good evening. My name is Afaf H Ahmad, known as Diva, from American Radio and Magazine, and I'm a radio host and a journalist.
So we can start. Thank you, everyone, for being with us. Thank you for taking the time out of your busy schedule to basically come and be part of this panel. Abdullah, before we dive into the 5 topics that we decided we're going to be basically asking you questions about, this is something personal, like I want to ask you about. In the beginning, what inspired you to run?
Yeah.
for this office, and does that continue to drive you now, or you've changed your motivation?
Yeah, I think, motivation is always been about supporting this community. My parents immigrated to Dearborn back in 70s and 80s. My parents met here, had their family here. And for me, running for office was wanting to give back and advocate for a community that's always advocated for me. Yeah. This was the community that provided my parents with social freedoms, financial opportunities, and I just wanted to continue advocating that the generation to come has more opportunities than the generation today. That continues to be my motivation. And hopefully, we'll have. We just got reelected for our second term, and so the residents have still been supporting us. We're very thankful for that, and so thank you to the whole community for that support. And hopefully, we'll have a third term when the time comes.
Just let's say hypothetically, assuming you can pass any legislation, which is probably it's not going to happen.
Yeah.
Assuming you can pass any legislation you want, what would be the most important thing for you to introduce and to get it accepted?
Yeah, that is. That's a tough question. Any legislation?
You didn't expect that one, huh?
Yeah, I didn't expect that one. I mean, there's three that come to mind. I'm gonna throw in three together.
Right.
I think the first is universal health care, so that nobody ever has to worry about access to health care again, or the affordability of their health care, the affordability of the prescription drugs. I think the second one is not legislation, but it's giving more money to schools, so that our teachers are paid dignified wages, so that teachers are started at a living wage, and are dignified for the work that they do, and that our students have enough money and the resources that they need to develop. And I think the third one would have to be pertaining to the air quality, to crack down on the corporate polluters that we have here in Dearborn, to make sure that our water is clean and accessible by every single family in the state of Michigan, and to improve our standards overall and push towards renewable energy.
Inshallah, we'll be diving more towards
those I think those
in
three
details.
Collectively would be the one thing I'd like to see passed. I forced it all into one.
Just as a follow-up to what you said about having a universal health care, the criticism to that is we don't want the USA to be another socialism community or communism community. What's your response to that?
Yeah, I mean, I don't think it's about being a socialist country. Every industrialized and advanced country in the world offers a form of universal health care. We're the only ones who do not. And our health care costs are higher than any other country in the world. And I think we need to talk strictly from the facts and from the data standpoint, from what the evidence suggests. Not having health care adds cost to the system.
Sure.
All the uninsured, all the underinsured, people who don't go to the doctor because their copays are too high, their deductibles are too much, they keep their children at home, that sickness gets bigger and bigger. I think that conversation is not being had. 40,000 people die a year because they don't have health insurance or access to health care. We're not having that conversation. I think universal health care I think health care is a right.
Okay.
And it's about time we started advocating for it as
Okay,
such.
let's dive to our topics now, and so we can have our panel as part of the discussion and they can ask their questions. The first topic we're going to be diving into is the auto insurance cost. We, in Dearborn, we have one of the highest insurance rates in the state, if not in the country. What are some of the factors that are basically, making those rates high? And why until now, despite the many proposals that, have been on the table, nothing has been changed?
Yeah. So Dearborn actually has the second highest rates in the state of Michigan.
Okay.
That's just what we know. Some of the factors as to why we have high rates.
Okay.
First and foremost, I'll talk about what's known as non-driving factors that are used to determine how much you pay in your insurance premium.
And just to make sure you guys can jump in and ask any question related to that topic right now.
Perfect.
Okay.
So when you go get auto insurance, when they quote you on auto insurance, if you are a woman, you pay more. If you only have a high school degree, not a college degree, you pay more.
Okay.
If you work a blue-collar job, a factory job, and not a white-collar job, they will make you pay more. If you're single, they'll make you pay more. If you have bad credit, they make you pay more. These non-driving factors that have nothing to do with how good of a driver you are factored into how much you pay. And the most important one here pertaining to the city of Dearborn, if you live in 48126, where we are now, zip code is used against you. So you can live in 48126 versus 48124.
Okay.
48126 is worse for you. Even if you had the same driving record, the same car, but if you lived 1 mile apart, your rate can fluctuate hundreds of dollars per month.
Okay.
Another component is fraud. There is so much fraud in the system. And to date, we actually have no fraud authority to screen out any of the bad things that are happening in our system. We have no fraud authority that's looking at insurance companies and all the corruption that's happening inside of the insurance companies. No fraud authority against any of the healthcare professionals that are overbilling or excessively billing, or against attorneys that are pushing clients into litigation. We have no fraud authority that's examining any of that. And I think that's something we also need to explore. And there's several other factors.
Any
but I'm
questions
happy
from
to-
our table?
Well, I like to.
On the mic, if you don't mind.
So if you, I mean, in general, the
ahead.
insurance rate or the whatever bill you've been working on.
Yeah.
I mean, I don't see how physically it's gonna work on the ground.
Yeah.
You know what I'm saying? It's kind of like it's gonna be very hard unless it's. You're talking about statewide, or you're talking about
Statewide.
just
I think
okay?
it's related
That
to
that may work. That may work.
Yeah.
But when you mentioned like the old cars, yeah, they used to, you can steal it and you can hide
Yeah.
it somewhere. Yeah, fraud was a little bit higher, but now with the new technology, you can discover cars. You can find them unless you take them and you tear them up so quick.
Yeah.
So I guess this is back to our community where we need more police presence and we need more, security.
Yeah.
So the insurance rate it'll go a little bit low.
Yeah.
But then the person who has absolutely no history of any tickets, he's paying the price too.
Yeah.
So it's not fair. It's not fair for those who are good people, which is the majority of them, to pay the price, because Detroit right now is cheaper than Dearborn.
There are some
Detroit is
areas,
cheaper
yeah.
than Dearborn.
Yeah.
So I'm not sure if you have a plan or how you're gonna do it.
Yeah. So
Since if you don't mind,
yeah.
Abdullah, since he mentioned Detroit, we had Mayor Duggan last year. He proposed, a law
Yeah.
to basically lower the thing, and I think you voted against it.
yes.
Could you explain why did you vote against it? And I think he's going again. Probably, I have a question from Dave from the Press and Guide. I'm going to ask you. I'll have
Yeah.
a follow up. But let's start with why did you vote no against this proposal?
Yeah, it was House Bill 5013.
Okay.
And the idea behind the bill was to create lower levels of coverage for a different price.
Okay.
Now, for example, one of those lower levels of coverage would have capped your medical health care benefits in an auto accident to $25,000 if
Okay.
you picked it here in Dearborn. But if we were to select that level of coverage here in Dearborn, you pick $25,000 of coverage, your insurance premium would still be more than somebody who drove in Ann Arbor, for example, with unlimited healthcare coverage,
Okay.
which I thought was just an injustice. It was inequitable that somebody in Ann Arbor, because they just lived in a different zip code, can have better benefits and pay less than we here have to do in Dearborn and Detroit. And it goes back to these non-driving factors. It goes back to this idea that because you live in this zip code, you should have to pay more, even if your driving record is better than somebody who lives in Ann Arbor. That was not addressed in that bill. Credit scores were still a part of that bill. If you were a woman, you still would have been charged more under that bill. So there's a lot of components to that bill that were not addressed. There was some good. It tried addressing fraud authority.
Okay.
It tried addressing cost of care. But it didn't go far enough to also hold the insurance companies accountable. There was no guarantee that insurance companies are going to lower our rate.
Okay. Afaf.
Okay, so why does the customer or the driver need to have the PIP, which is personal injury protection, which will increase 42% of the coverage, where we have 38 states do not have this coverage?
Yeah.
Why do we have to have this?
Yeah, so there's the PIP, and then there's also what's known as the MCCA.
Okay.
So the PIP, for those who don't know, if you look at your auto insurance bill, if you live in Dearborn, the majority of your bill is PIP, is what they call it. And that's the health care coverage under auto insurance. We are a no-fault state, meaning that without having to litigate in an accident, you automatically will get coverage from your insurance, and it'll cover your health care benefits under PIP. We also have the Catastrophic Claims Association. This is a fee everybody will see as additional services on your insurance premium for $192 per year. What this does is it guarantees that if you're in a catastrophic incident, let's say, unfortunately, la samhallah, you get in a car accident, you become paraplegic. You can no longer walk, you're accessible. That care costs in the millions of dollars. That $190 fee that you pay per vehicle will make sure that you have health care coverage for the rest of your life. We're the only state that does that. And because we are the only state that does that, we are actually the best state in the country for healthcare coverage as it pertains to auto accidents. It's also important to know, if I may, most health insurance companies outside of auto insurance do not cover healthcare related to any auto accidents because of the system that we have. And that's why you pay the PIP in your auto insurance. Because many health insurance companies to date right now, if you get in a car accident, if you read the fine print in your insurance coverage, they will say we do not cover accidents related to, we do not cover healthcare related to auto insurance.
Okay, but some people, they got hit with people, they have no insurance at all.
Yeah.
So how do they get coverage? Who will pay their medical bills if, like, for example, I hit you, I don't have no insurance. How are you going to get paid? Who's going to get pay your bills?
So if I have auto insurance, there's also the Michigan assigned claims. The assigned claims make sure that I have health coverage regardless of who hit me if I was not at fault. Even if I had insurance or not, if I was walking across the street as a pedestrian and I got hit by you who had no insurance, the Michigan assigned claims will provide me with the health care that I need. As it pertains to those that drive without coverage, they will receive no cover. They will receive no benefits at all. And it's unfortunate. Because I think back to Zach's point, nobody wants to be a bad actor. Insurance rates are just too high, and it locks people out from buying auto insurance. And it's something that we need to address.
I think this question is related to both auto insurance and healthcare at the same time. We've noticed, and there's so many claims made that, for example, if you've been hit in an auto accident and the insurance is paying for you, and somebody that's paying from their own pocket, your bill probably will be 10 times higher because the healthcare or the insurance is paying.
Yeah.
Shouldn't that be solved so it could be part of the solution for the high insurance rates?
So you mean address the healthcare portion?
Yeah.
So, I'm a big advocate
for example, MRI, if
Yeah.
you're paying out of your pocket, probably you're paying 1,000, but if the healthcare is paying for it, the hospital is going to charge you. There's no cap on how much.
So this is called the fee schedule component. This is what we talked about, capping the costs on care.
Exactly.
So if I were to walk in, I think Basha Diagnostic charges $250 for an MRI.
Thank you.
If I were to go there right now. If I get injured on the job, you have workers' comp insurance that many employers carry. Instead of $250, they'll pay maybe $500. If you get injured in an auto accident, providers can charge whatever they want to an insurance company. They can charge $1,000, $2,000 for the same exact MRI. That's something that also adds to the high cost and has been a part of the conversation into discussing how can we make sure that providers get what they need to cover the cost of services, but it's not unreasonable and adding to the high cost of insurance that we have today.
Very
so
good.
it is a very strong point.
Akram and Khodr, do you have any question about this topic?
I have a question. So, if it happens where if you got into a car accident and you say you hit somebody and both of you guys are not covered, I heard that there is a state agency that you can file a claim that because you are the victim. Let's say, especially if you are on the passenger seat, if you're not the one who's driving, and both don't have insurance, the driver that you were in and the guy that you guys either hit or hit you guys.
Yeah.
Is it true that there's an agency where people can file as a victim so they don't need to pay out of pocket?
So if you were parked, for example, and somebody hits you, right, and so there's one driver at fault, the other not at fault, I believe, and I'd have to double check if it's the same incidents as opposed to a pedestrian walking, but I believe if you were the party not at fault, you would be allowed to access the assigned claims where you can get healthcare benefits. But to the party at fault, if they were the ones driving uninsured, unfortunately, I believe they will not have access to any healthcare. More than likely, that individual, if it's catastrophically injured, you'd have to deplete their savings, get on Medicaid, and then have Medicaid cover their services.
See, it happens with me actually, and when I went to the ER a few months ago, and I just wanted to make an X-ray just to make sure that nothing is serious, his injury.
Yeah.
They told me at the ER that if I didn't mention auto accident, my insurance would have covered it without any question.
Yeah.
As soon as I mentioned this is pertaining a car accident, they said your insurance cannot cover that, and either the driver that you were with, his insurance has to cover it, or the other guy. But it happened that neither had insurance, so I had to pay it out of my own pocket. I mean, I'm just giving an example.
Yeah, so the unfortunate reality is the reason the hospital asks you is, one, your healthcare insurance provider doesn't want to pay it if the auto insurance provider should pay it. Also, the hospitals like to ask it because if it's auto insurance versus health insurance, they can charge more to auto insurance. So it's a very unjust system. or unjust system, excuse me, and we need to acknowledge it and try to what's the word I'm looking for? Recognize that solutions need to be very comprehensive to address everything.
Just so we can close that topic and move to the next one, Abdullah, we have a question from Dave from the Press and Guide. He's saying Detroit Mayor Mike Duggan is suing over high insurance rate.
Yes.
Asked, would you testify?
Yeah.
Would you testify?
Would I testify? So I guess my follow-up question would be testify in what regard? If I testify and, as an individual with high auto insurance rates, 100%, I can go and testify and show my premium. My mother's an insurance agent. You know that.
Yep.
She can testify as to the high auto insurance rates that people here in Dearborn have. I think the mayor is trying to push down the notion that our system is very unjust, which is 100% true. It actually is more unjust to communities of color, such as Dearborn, such as Detroit, 100% true there. I'm very interested to see what comes out of the court case.
Okay.
From the legislative branch standpoint, we'll not jump into the judiciary branch as to make sure the separation of power is there, but watching that court case very closely.
Very good.
One last question.
We need to close the topic, but go ahead. Do it on the mic.
One last question. Abdullah, I've been looking for, I couldn't find, how much is estimated insurance for blind drivers?
That's a good one. Okay.
I don't think there's a price out there.
It's priceless, Khodr. Anybody that's watching us on Facebook, feel free to write your questions or comment in the comment box. We'll do our best to basically ask it to our guest or to our panel. If you have a question to our guest or to our panel, feel free to write it in the comment box. All of the shows that we do are available on our website. Just go to the www.whatsappmedianetwork.com. You'll be able to watch all of the episodes. We're gonna jump now to the air and water quality topic, and I'm gonna start from something that happened just recently. The strong odor that we basically many
from
people
Marathon.
here from the Marathon refinery. First, is there any update on the situation? Marathon, they came out and they said it doesn't impact air quality. I heard you have some disagreement with that. So fill us in on that topic in specific.
I believe this was last week.
Yep.
Last weekend, actually, almost a week ago. And what happened was one of the flares that burns off many of the gases cracked at Marathon, and therefore not all of the chemicals being released were actually burned off, which led to a strong odor. The chemicals that were released, very small amounts, can lead to a very strong odor, which impacted the quality of life for residents in the entirety of the area, from the east end, south end of Dearborn, very strongly to parts of Detroit. Even some folks in St. Clair who said they were able to smell the gases from that far away. I had text messages and constituents calling my office saying that they struggle to walk outside. Heavy chest, heavy breathing in this area. So for me, it's undoubtedly people's quality of life was impacted regardless of anything that Marathon tells me. We had a phone call with Marathon, with the DEQ, and with the EPA at the federal level. DEQ is the Department of Environmental Quality, and then the EPA is at the national level, the equivalent. They're still gathering more information. The data that they collected is suggesting that levels of toxins did not rise above certain limits that they're monitoring. Unfortunately, those limits themselves that are set by under current law may be too low and too weak to begin with. And so we don't have an exact answer as to the true health impact that this incident had. And we're still asking more questions and waiting for more answers.
Have they promised to take any measures to prevent such incident to happen?
So they have fixed the part of the plant that was ineffective. And I think Detroit City Council is examining some emergency evacuation policies. I think something that the city of Dearborn can maybe look at a later point.
You guys can jump into the conversation, please.
So, since you're talking about this subject, as you know, Dearborn has a high rate of cancer cases, and we already polluted without an additional pollution coming in from another place. If someone is burning something in his backyard, I had a neighbor who was burning a suitcase. And it was terrible black smoke. I mean, the police came, and they gave him, I think, citation or something. I don't know what they gave him. But this corporation seems like they got away with a lot of things. So I think those corporations needs to be You know, how would I know 10 years from now that person who was smelling this
Yeah.
smell is not going to have cancer or have problem breathing?
Long-term effect.
Yeah.
So,
it's
I
a
mean,
very
I
great
think the
point.
state, if you don't mind, should, that area that was impacted,
Yeah.
they should test them all,
Yeah.
every single one of them. And if they see anything not normal, that company should be responsible.
Yeah. 100%. I agree with the short-term effects of not being able to breathe that day or the day after. There's also long-term effects to all of the pollutants that are emitted by all the corporations throughout Southeast Michigan. Unfortunately, from just a health ranking standpoint, Wayne County comes in last in the state of Michigan. The south end of Dearborn, southwest Detroit, is known as the asthma epicenter. We have the highest rates of asthma in the whole state. You're 4 times more likely to have asthma by living just in those zip codes than anywhere else in the state of Michigan, just because you're born there. And so I do think that over the last decade, corporations have had it easy.
Okay.
They've not been held accountable. We at the state level have been introducing many bills to try to increase the standards, to try to hold them accountable, and then push them back. I think last January, many people here saw that we pushed back against a factory that was trying to open up a new power plant. And we were successful in that effort. Recently, myself, partnering with Salah Ali, who lives in the South End, with Nick Leonard, who's an attorney with an environmental justice group, as well as Commissioner Sam Baidoun, Congresswoman Debbie Dingell, and State Senator Sylvia Santana, worked on a city council ordinance that we shared with them that will actually push back on a lot of the pollution that comes from trucks that are driving.
Abdullah, in regards to that city ordinance, did you
Yeah.
guys collaborate with city council members before introducing that ordinance?
Yeah, so City Council was aware that I was working on drafting that ordinance.
Okay.
Once we had it drafted, so we modeled an
Best
ordinance.
second, just so we
Yeah.
keep your mic is on when you just.
We modeled ordinance that was passed in the city of Detroit and city of Chicago. And so we kind of modeled that ordinance and then added some components very specific to Dearborn. Once we had it, we shared it with city council, and we also provided them a 2-page executive summary.
Very good.
And then we said we're willing and ready to work hand in hand, try to get something done. And hopefully we'll continue those meetings in the weeks to come.
Afaf, go ahead.
Okay, can you just do some clarification, because I'm one of the citizens, I got lost about this. When we had the issue almost 10 days ago when the governor came and announced that the heat need to drop down, I think
Yeah,
to 65 or something,
So many
and then there were like a lot of messages on social media, says that that heat does not go through consumer energy, it's a DTE and it's two total different companies.
Yeah.
Can you explain that to us, because I'm confused too? So where do we get our heat from, DTE or from consumer energy?
Yeah, so the short answer is both. Even DTE came out and asked residents to try to lower their thermometer at the household in addition to consumers. Consumers had an incident where they were scared because of the really low levels that, essentially they would run out of the ability to provide the energy needed to all the households.
Yep.
And so they asked the community to kind of join in together and lower your thermometers just a few degrees so that everybody can get through this really cold successfully. And thankfully, many families actually did. And it provided us with the ability to make it through that, what's it called? What's the
pressure, there was a
yeah, but what are they calling it? I forget the terminology right now. Climate change.
Yes.
But we were able to successfully make it through the extreme cold. And so consumers is trying to make sure that in the future that's not the issue. But it's both consumers and DTE from where you get your energy from, depending on where you
Go
live.
ahead, Khodr.
Yeah, Abdullah, I have a question for you. As you know, that the governor is
Polar
solely.
vortex. That's what it's called, sorry.
I'm sorry.
Go ahead, Khodr.
Yeah. So the governor is solely concerned about fixing the roads and the air and the environment. As you know, just recently, Republicans turned down an executive order that the governor brought forward to create an entire department or division that was aiming to solely focus on cleaning water. Work on getting clean water and clean air. Can you please elaborate on that?
Yeah, so the governor, through executive order, restructured the Department of Environmental Quality to call it, the acronym would have been EAGLE. It would have established an environmental justice division. It would have established a Great Lakes division to address water specifically. Unfortunately, the Republicans undid that executive order.
Okay.
And they did so because, the reality is the leadership in the legislature, which is Republican led, and I'm not a partisan person, but the vote was down party lines. We're not as focused on improving water quality in the state of Michigan and air quality and environmental justice issues. Governor Whitmer, I should say, has said that she has many tools in the toolkit and that she'll be back with an alternative for how she can still create the department that she wishes through different measures. And so we're still waiting to see
Abdullah,
what she
I know
does.
you introduced like something, probably similar. She was
Yeah.
trying to reorganize, but I know you
Yes.
introduced a bill. You called it the Accessible and Affordable Water Act.
Yes.
Any update on this bill? Do you think this will pass?
Yeah, so this was the first bill of a package that we hope to introduce before the summer.
Okay.
And essentially what we want to do is make sure that any municipality, when discussing water rates within a community, that they're taking into account, can the majority of residents in that community afford the water rate they're trying to pass?
Okay.
And so it provides them with a foundation of things they need to be thinking about to ensure water is accessible and affordable by all the families in their district. Because, for example, many families in Detroit, they get their water shut off because bills are egregious. For many families in Detroit and Flint, their water bills are more per month than Nestle pays all year to take money for water from our Great Lakes. So I think that is an injustice, and this was just one step in a long path to try to adjust that.
Go ahead.
So
Your mic is on?
Yeah.
Perfect. Okay.
So you're talking about the water quality or the water availability for people?
Both. So I think when we speak of water quality, we want to talk about affordability and accessibility.
So the water that we have or we drink in
Yeah.
our city is controlled, the bill is controlled by the city. But then it goes to the state for collection when someone doesn't pay for some reason.
Correct.
Is it because they want to take it out of your taxes if you don't pay? I wonder, how is the state involved with billing?
Yeah,
You know what I'm saying?
Yeah.
Like, why would they take it to the state if you don't pay?
Yeah. So
I mean, if you don't mind, if you don't pay the taxes, if you don't pay your taxes, it goes to the county, right? That's
the
normally.
house is different.
Yeah,
Depends if you have a
but-
mortgage or if you paid
But
off your
for
mortgage.
water, I mean, the state somehow is in control of how much it's going to be.
Yes, but the rates are dictated more at the local level. And I think that's where the conversation needs to be had from a local level. From a state level, we can put in parameters to ensure that local municipalities are evaluating the cost of the water rates that they're forcing onto their residents. From a quality standpoint, just to make sure that it's clean water, I think the state has to make sure that we're investing heavily in the water infrastructure that we have throughout the community, underground and such. And I think you'll see Governor Whitmer propose, hopefully in this budget cycle, not only how to fix roads, but I believe she's also going to touch on how to fix our infrastructure overall.
Okay.
And that includes water infrastructure,
And we're
road
gonna talk about
infrastructure,
that.
public transit, and so on.
Yes. Any question about that topic before I close it was one question we have from Dave.
أكرم ليش ساكت يا أكرم؟
ما عندي شيء.
Okay, طيب, Abdullah, we have another question from Dave. Dave, actually, he sent one question for each topic.
Dave
that
is
we-
great.
Yeah. So he's saying parts of Wayne County have some of the worst air quality in the state. What
Yes.
specifically can be done to clean it up? And also, are you personally working on anything?
Yes, so we had it's a great question. We had a package of bills we introduced last term.
Okay.
The first thing, I think one of the most important things is known as cumulative impact. Right now, if a single corporation applies for a permit
Okay.
to push out pollution or push out emissions, it's evaluated. Does this corporation come below the threshold that the state has enacted? What we need to do is say, do all the corporations in this area come below the threshold? Not each individual corporation. That makes a very big difference. So instead of saying does corporate A pollute less than 100, is does corporate A plus B plus C plus D come below 100.
Okay.
That's an environmental justice piece. That's one thing we've worked on and trying to develop. A second thing is just holding the departments and the corporations accountable. Whenever we have a hearing in the public, usually the State Department is there, but the corporation is not present.
Very good.
We want the corporation to be present. We also want to be informed as citizens or as residents every time a corporation requests a new permit to add more pollutants, and anytime they've had a violation. And so we're working on making sure that there's communication between the departments and to the residents more
Very good.
seamlessly.
Let's move to our next topic, which is school funding. Like we mentioned in the beginning of the show, our first guest was Dr. Glenn Maleko, and one of the concerns he had when he was talking, it's basically school funding and cuts that are coming to school funding probably by next year, which will basically impact Dearborn very because we get paid by pupil, I believe.
Per pupil.
Yeah. So school funding has always been tricky, and many people felt like cheated when they this is another question we have from Facebook, Abdullah. School funding has always been tricky. Many people felt cheated when they realized that lottery funds were being used as replacement money, additional money for schools.
Yeah.
If it were up to you, would you change that policy?
Yeah, if it were up to me, so what happens is we have the school aid fund.
Okay.
And the school aid fund is always rated by members of the legislature or by the governor to provide corporate tax breaks.
Okay.
And then everybody asks, well, where does the lotto money go? Well, every time we take out of the school aid, the lotto is supposed to go into the school aid.
Okay.
But we keep taking out of the school aid, and the lotto is just trying to fill a gap that we keep creating bigger and bigger. If it were up to me, we'd lock up the school aid and nobody can touch it.
Okay.
And we'd add more money to the school
Where
aid.
would you get the money that you need?
So
Which areas?
there's several ways. I'm a big proponent of what's known as a graduated income tax.
Okay.
And this would actually decrease the taxes for 98% of Michigan families below, I believe it's about $200,000 mark,
Okay.
and still generate almost $1 billion new dollars.
Okay.
That is one big idea. Secondly,
Is it similar to what President Trump proposed?
it's similar to, if you're familiar with
Bernie's-
Alexandria Ocasio-Cortez's
for sure.
proposal, marginal rates.
Yeah.
I'm a big proponent of doing away with all these corporate giveaways.
Uh-huh.
Right now, the lottery brings in more money than corporate taxes, which is just mind-blowing.
But the money is actually going for the school fund. From the lottery.
Not from the lottery, it does go in, but then they take out from a different fund that's supposed to feed into schools. So unfortunately, it's rated. I think we need to add more money to schools to not only get more money per pupils, we also need to pay teachers a dignified salary.
Okay.
I am not above looking at what should be the starting salary for all educators around the $50,000 mark.
Okay.
No educator should be making less. We're going to have a teacher shortage crisis on our hands. It's beginning, it's developing, it's already there. And that's something that we need to address soon.
Even
Okay, let's go by Khodr, and then we'll, since this is, go ahead, Khodr.
This is a very important topic. I have two questions for you, Abdullah.
Go ahead.
The first question is, do you have any insights or idea about, because the budget will be out next month.
Yes.
The government will be issuing the budget next month,
Yes.
and it's going to include pretty much everything. Do you have an idea about how, what is the number, what is her plan regarding funding the schools? And then number two, regarding special education, this is a very important topic and very crucial. Often a lot of money spent, either you see little results or no results at all. Do you know if the state of Michigan under Governor Whitmer's leadership will be more interested in implementing more vocational, more hands-on stuff for these students instead of sitting in a classroom and not getting any forward?
Yeah, so I'll try not to be as much a fortune teller as opposed to, I can tell you based on what I know from what the governor has said. Okay. She gave her state of the state last week. And she spent a large time talking about education, talking about schools. And I'll work from the last question up. So as it pertains to vocational training, skilled trades training, she talked about guaranteeing that high school graduates have access to 2-year programs after graduation. Be it free community college, one thing she talked about, free 2 years of college at a 4-year university, or a pathway towards vocational and skilled trades training. That's something that she wants to strongly emphasize and push students to and provide funding for. Yeah. The funding mechanism, to be determined. I can't tell you how she has suggested to pay for it. We're waiting to see with the announcement of her budget.
Sure. Just so you know that a lot of the special needs students are on the path of certificate of completion. Mm-hmm. So this means that they can't attend college. Do you know, or are you in the picture of what there might be in store for them?
I cannot tell you what was mentioned regarding individuals with differing needs pertaining to education specifically. That's something I'm happy to follow up with, though, to garner more information once the budget is released, to have those conversations and to bring that information back. And as it pertains to funding mechanism, I think the governor, as she announces her budget, will also propose, I believe, how she plans to go about funding the various programs. So I don't want to be too premature and speak on her behalf on how I would fund it. But I'm very interested to see what her plans and proposals are.
Abdullah, during the McKenna conference last year, the director of education and policy, he said the problem is not the availability of the money. The problem is how the money is being used.
100%.
So you agree with him?
I agree. I mean, to date, right now, we give away over $600 million a year to corporate tax giveaways.
Okay.
Which that can be money easily accessible to schools. If you look at
Just to elaborate,
Yeah.
he's not saying he's not saying that the state is not knowing how to use the money. He's
Yeah.
saying the schools are not allocating the money right.
So he believes down at the school level system.
Yes.
Okay.
Just to be exact.
Got it. Yeah, so as it pertains to how individual schools allocate their money, I mean, I think there are restrictions on how some of the money is used.
Okay.
Aside from that, I'm smart enough to know what I don't know. And I'll be the first to say I don't know the answer to that question.
Go ahead, Afaf.
So
Okay.
happy to dig into it, though, and have that
Okay.
conversation with Dr. Maleko.
Yes.
Okay. Do you believe that when Trump passed regulation law, I don't know what you guys call it, when he dropped the corporate taxes from 35% to 21%? For example, today in the news, Amazon is not paying federal taxes for 2017 and 18.
Yeah.
So can't Michigan, for example, say, hey, we respect you, Mr. President, because I don't know how the law works.
Yeah.
We thank you for this, but no, we want to make sure we collect enough taxes from these companies to fund our programs, whatever we need for the Michigan, whether fixing roads, whether education. So does the president has the authority to do that drop down from 35 to 21%,
Yeah.
affecting the services, or can you step in and the governor or whatever and say, no, we don't want to implement that in Michigan?
Yeah.
Can you explain that to us, please?
Yeah, so what the Trump proposed and was passed by the Congress, it was passed by the Republican-led Congress at the time. Unfortunately, the federal tax rate is separate than the state tax rate. And so as a state, we have our own corporate tax rate, which Governor Snyder we had the fourth highest when he first came into office. We're now I believe, the 45th or 46th highest, so making us the fourth lowest. So we went completely backwards. In the state of Michigan, unfortunately, so that's something that Governor Whitmer can suggest, can try to change to make sure that more taxes are paid, people pay their fair share. That major corporations are paying their fair share, because right now individuals' income taxes provides more to our budget than corporations do.
Very good.
That's the reality. The
Yes.
lottery provides more than corporations do.
So something needs to be done.
So she can make a recommendation, but you do have a Republican-led House and a Republican-led Senate here in the state of Michigan. And so she has to understand that she needs to work with individuals across the aisle. And I think this governor is very focused on getting a job done and focused on compromise. And so we'll see what's to be done.
Just so we can, get more done through the enough time that we have. I'm going to move to basically healthcare. Recently, you've been appointed the vice chair of the Health and Human Services Budget Committee. Dave is asking you basically, what can be done locally to drive the cost of healthcare down? And is there anything people can sign up for that would limit the cost to individuals?
Yeah, so I think I need him to elaborate more on what he means by limiting the cost to individuals.
Okay.
I think from a standpoint, what can be done to lower healthcare costs, I think there's many things. First and foremost, the pharmaceutical industry is the wild, wild west. Okay. We have many middle actors that buy the pharmaceutical drugs and provide them to insurance companies, and which go down to the pharmacists, which are not even regulated or needed to be licensed here in the state. Okay. In the state of Ohio, for example, they conducted a study and found that they pay these middlemen, known as pharmacy benefit managers, over $200 million extra that they just keep to their own pockets. Okay. And so they canceled all the contracts and created new contracts to limit that. I think that's one thing we can do. I think a second thing we can do is invest in primary and preventative care to make sure people have access to their doctor regardless of what their copay is. We introduced a bill called the $5 copay. No matter what insurance plan you had, if you wanted to go see your primary doctor, at most you would pay $5. Okay. And that's it.
So what happened?
Go ahead.
So what happened to that bill?
Yeah, so we're still working on getting it through. I actually have a majority of insurance companies that were okay with the bill. But there were the head of the chair of the committee at the time was not a fan of the bill. And so we're still having those conversations on advocating it, try to push it through.
So like the copay so
would be
much-
capped at
so much-
$5. And
yeah,
your
but
insurance
then-
company would have to pay the rest.
Then you have the 80-20 because you have to pay out
So
of pocket.
co-insurance would not apply. So we drew it specifically so that $5 is the maximum that you can pay to go see a primary doctor.
Even
That
if
way
you have a private insurance,
even if you have private insurance.
Blue Cross or whatever.
Exactly. It kind of mimics Medicaid. Medicaid, some families pay, $2 to $5 to go see their doctor. It mimics the same thing for private insurance plans. And the reason it's so important is even those that have private insurance, 50% of families actually don't go to the doctor because their copay is too high. Some of you have children. If one child gets sick, they all get sick.
The whole family gets
and
sick.
you get sick.
So-
And so every time you go to the doctor, if I can finish, your copay is $40. You go one time. You have to go back for a follow-up visit. There's another $40. Your second child gets sick. That's another $40. You have to go back for a third follow-up. That's $40. Then you get sick. That's $40. Another follow-up. That's $40. You want to cap it at $5 to make sure people are going, they have the access, and they prevent a disease from progressing
each visit.
each visit.
How about businesses? I know, like, if I work for a company, they will pay for my insurance
Yes.
percentage.
Majority of families.
And I'll pay probably a third of what they pay,
Yeah.
which is still good. I mean, it's still high, but it's still okay.
Yeah.
Now, for people who have their own business
Yeah,
and they want to buy insurance for their employees,
very high.
it's very expensive.
Yes.
Now, do you have anything within that?
Yeah, so we're working with small businesses to try to make healthcare plans more affordable. If we backtrack a little bit to the first thing I'd love to see enacted if I had a magic wand is universal healthcare. So this conversation doesn't even need to be had. That regardless of having a job or not having a job, small business or big business, unemployed or employed, you have healthcare, you have that safety net. And so that's something that we strongly advocate for. I was a co-sponsor of the Medicare for All bill here in the state of Michigan, and strongly watching it at the national level. So that is something we strongly advocate for, but more can be done.
Isn't it Canada has that?
Canada has a similar system, yes, and so do other industrialized countries just across
What's
the
preventing
seas.
us here in Michigan or in USA in general? Let's stay in Michigan. since
Yeah,
that's
yeah.
your
I mean,
area.
I think it's a matter of
Yeah.
it's a matter of leadership in the past.
Okay.
The conversation always comes
So you
down
believe
to
with the current leadership we have in Michigan, something could be done?
not on universal health care.
Not on
You
universal.
still have a Republican-led legislature, and I think it's just
Any
not going to be
major
feasible.
changes you expect to healthcare?
Yeah, I do know that the governor is focused on expanding Medicaid to
Okay.
making it more available to more families and trying to eliminate the work requirements that were added recently.
Okay.
So I think there's more to watch with what she wants to do with the Healthy Michigan plan
Very good.
and with Medicaid.
Any question? That's the last question for that topic before we move to infrastructure and we close it with infrastructure.
I believe you have a master degree in public health or
Yes.
something. Okay, let me ask you a question. I'm not going to mention names, nothing, but I have a case right now where I believe there is a fault from a state. There's a doctor been giving injections to patients. I have the case, I'm studying it right now. And the wholesaler where he bring the shots from, the injections, are not approved by the FDA. He billed the insurances, he collected the money, the state find out about it. They only fine him $2,000 for violation public health only. I have the documents and I know the information, everything, and it was almost 6 injections. My question is, why didn't the state order the doctor to follow up with the patients and see, because these injections have side effects and it was given wrongfully to the patients. Why wouldn't the state, it's a couple pages from the state, I have the documentation, and he paid only $2,000 fine. Why didn't they order him to go and follow up with the patients, inform them what happened, see if there's any side effects, and also refund those patients with co-pays and also the insurances. So how did he bill those insurances with injections that he brought it from a place is not FDA approved? I was surprised.
So, unfortunately, I don't have the answer. I can touch base with you offline to get the specifics and to follow up. I don't have the
I have all
specifics.
the
Yeah,
paperwork.
I don't have the information to provide you with the answer right now, but happy to follow up afterwards.
Very good. Let's
Okay.
move to infrastructure. Any on the mic? Go ahead.
Yes. Yeah, I appreciate your being here, and always, we always look up to see you in better places, and you are our role model, like I told you before, for everybody. So I have a question about Department of Transportation.
Yeah.
Where I'm not sure if that would fit your, like if we want to change a traffic light in Dearborn, like extend it another 10 seconds.
Yeah.
Timing.
10 seconds. Can you stop touching me?
I'm not touching you, I'm just fixing.
So,
Whole table there.
We have
So,
8 minutes to finish. Let's.
okay, so anyways, every time we try to work with somebody on expanding or extending the light
Yeah.
to have people make turns and
Yeah.
without having, the city officials, they say, oh, the state of Michigan, it's the state, we're not giving us extra light. The state will not put an extra arrow, let's say Chase and Warren Avenue, where we needed an arrow for people who go on left
Yeah.
on Chase. So because by the time the green light goes off,
Yep.
they won't make it.
Yeah.
So really, we need help.
Yeah.
What
So
I'm
there's a
asking is really, can you like somehow put together like the roads are terrible, the state roads, and
Just to put it on
kinda like-
just to put it in perspective.
Yeah.
Who's responsible first for city lights? Is
Yeah.
it the
so
city or
so if
the
it's a
state?
city road, I believe it's the city's responsibility.
well, we have state, county, cities.
Yeah, so the state, county,
That's
city.
what I
I think, also, you're
Public
just talking about a
safety.
technology standpoint, many cities also incorporated sensors in their lights. So it actually knows how many cars are in a lane, and it adjusts automatically to alleviate traffic. So maybe that's an investment that's the city, that the county, the state can look at. But
Very
I'm
good.
happy to connect with you offline and talk about specifically what roads and what can be done.
If we can have somebody from the Department of Transportation,
Yeah.
like a contact that we can call them or her or him, sit with them and go over these issues that we have.
Yeah.
And we will give them exactly which traffic lights we're talking about.
Okay.
And then we will put our city authority on the spot and say, go talk to that person. He's willing to help us out.
Yeah. Okay. I think we definitely all work together to get something done.
Abdullah, during Governor Whitemer's campaign, she kept saying, let's fix the damn roads.
Yeah.
What's her plan to fix the damn roads and where she's going to be able to get the money from?
Yeah, I think, it's the $2 billion question, right? That's
Exactly.
we're
Exactly.
the $2 billion question is, how do you come up with the funds to pay for the roads? I think it's no secret to anybody. We have the worst roads in the country. On top of that, you slash a tire, you slash 2 tires. You don't want to file your auto insurance because your rates are already too high, and so you're going to try to pay for it out of pocket. But the unfortunate reality is the majority of Michigan families don't even have $500 in a savings account to pay for slash tires. So I call it the pothole tax, which we're all paying regardless because of our bad roads. I think we're waiting to see. I think if anybody can get it done, it is Governor Whitmer. She is somebody that's known to work across the aisle.
Have
Her-
you discussed details of how
So
she
her
plans?
so the speech that she gave was value oriented and where she wanted to focus.
Okay.
The state of the state is not meant to be a very detailed.
No, I mean not on the state of the state.
Yes.
In terms of, I mean, you're part of, the,
The Democratic Party.
Democratic
and such.
Party.
Yeah, so she hasn't shared it with the House members yet.
Okay.
I think when she shares the budget to the public in the first week of March,
Okay.
when she shares that preview, we will have an idea of where the funding mechanisms will come into place as to pay for the long-term investment that's needed for our infrastructure.
We've heard so many complaints from residents in Michigan saying why some areas and some roads
Yeah.
gets paved and gets done like multiple times despite probably they don't need it. But
Yeah.
just because there is money, they're doing it. And
Yeah.
at the time that roads, like, for example, in Wayne County,
Yeah.
you can't even drive on them.
Yeah, it's a great question. So one of the, PA Act 51, which is 50 or 51, double check, where it's basically how the funding is
Distributed.
appropriated across the state. It's appropriated equally.
Okay.
Even though the majority of drivers are in Southeast Michigan, people in the roads up north get the same amount of money as the roads down here. And so something we need to change, and there's a proposal, a Republican proposal actually, that says more money should go to the counties that have more cars registered.
Okay.
Which was a
there
great
is that
idea.
proposal.
That's a Republican proposal. It's bipartisan. And so we're hoping that proposal also helps with even the current funding that we have, just giving more money to Southeast Michigan and less money would go up north.
Up north.
But it's not as needed up north as to where we have trucks from Canada, trucks from neighboring states coming across our roads. We need more money.
Since you
and we
mentioned
need more
trucks,
resources.
why are we allowing trucks to have weight?
Yeah,
that's
weight
way
limits.
over Ohio, for example?
Yes. It's about twice the weight limit as Ohio.
Exactly.
I'm a big fan of lowering our weight
Who would
limits.
be able to change it? Can
It's
you
a
guys
state
pass
law.
Can
It's
you
a
guys
state
pass a
law.
legislation?
It is a conversation that is being had.
Okay.
It is a state law, something I advocate for, lowering our weight limits,
Mm-hmm.
because it's not fair that these heavy trucks are the ones really causing damage
Mm-hmm.
to the roads, but then we in turn pay for it because our registration fee goes up or our gas tax goes up. So it is something that's a part of the solution.
Very quick, Afaf, because we have to
I
close.
just got a message. I mean, I don't know if it's on our topic or not, but just make a very quick explanation. Does the shutdown that the Trump announced today is affecting any services? That's the question.
So there's no shutdown. So
Okay.
they
Signing
reached
the
they signed. I think they reached a deal. He's calling a national emergency to do what he wants outside of the budget with the border wall. But there will be no government shutdown, so services should not be affected.
As part of infrastructure, Abdullah, we always focus on the road, but also as part of infrastructure is the lead pipes that we have.
Water
Those-
infrastructure,
yeah,
lead
the
pipes,
water.
yeah.
I mean, the Flint crisis didn't happen not too long ago.
Yes, still
And
ongoing.
how to prevent another crisis from
Yeah.
happening? Because we still have lead pipes in the road.
And I think it's
the
about
underground.
the talk for the need of a long-term infrastructure plan.
Mm-hmm.
And we talk infrastructure, you're 100,000% right. We're talking water infrastructure, we're talking road infrastructure. We also have to talk about regional transit, public transit,
Mm-hmm.
getting less cars on the streets, more public transit, more buses. And so, more speedways, speed rails, excuse me. And so it's definitely a part of the conversation.
Just so I close with
Yeah.
quick questions and quick answers, if you don't mind,
Yes.
Abdullah. And if you guys will give you a closing remarks, 30 seconds each, if you guys don't mind, 30 to 40 and we'll give you the closing remark. Very quick and with quick answers, if you don't mind.
Okay.
What's the biggest issue facing Dearborn that you can act upon to improve, and how will you work to make it better?
I would say right now it's air quality, and we can act by all working together at the various levels of government to come together and enact what we can at the city level and keep pushing for what we have to at the state level.
Very good. Another one, the state leadership turned to be democratic. We have the governor as democratic,
Yes.
but the
Legislature.
legislature is controlled by Republican.
Yes.
How do you guys plan? And we've seen many, the executive order have been basically overturned
Yes.
by Republicans. How do you guys plan to work across the aisles to make your vision and Governor Whitemer's vision a
Yeah.
reality?
Well, the Speaker of the House, Lee Chatfield, who's a Republican, spoke about wanting the governor to succeed, because if the governor succeeds, we all succeed. And so we're hoping that this bipartisan atmosphere environment continues throughout the entirety of the term. It's to be determined. I think you have smaller margins. There's only a 3-vote margin in both the House and the Senate.
Very
and
good.
so that's going to force people to come to the negotiating table.
Okay, go ahead. Let's do the closing remarks.
Question, Abdullah. Thank you for coming. What bills are you working on right now? I'm sorry, I'm a little bit sick.
Go ahead.
What bills are you working on right now, and what have you have any success with any of them?
Let's make them quick.
Yeah. We're working on everything from environmental justice to water quality to healthcare to civil rights for immigrant communities. We've had success, and the majority of bills I've introduced are actually bipartisan. We got many Republicans to support the majority of bills that we have introduced. We had 2 bills signed into law last year, 4 resolutions enacted, and so we're hoping to have more progress. We also brought a lot of money down for the community.
Afaf.
My question is different. What would you like to, what's your message to the parents and children to have them involved more in politics and to reach wherever you are right now?
Yeah, I mean, I think it's, the schools, if the school is making a trip to Lansing, join your children to the trip to Lansing. Contact my office. We're happy to accept any interns if anybody wants to come up and shadow for the day. Stay engaged. Find something you're very passionate about. Be involved and continue moving forward.
Akram or Khodr?
No, I just thank you, Abdullah, for informative information, and wish you best luck.
Thank you, Akram.
Khodr?
Abdullah, thank you for everything. Thank you for being accessible. And let me shout out to Hussein that Abdullah always been there for everybody. And let me say that I'm really hoping to reactivate and to restart the state of Michigan disability concerns. We need that in our state, for the betterment of all citizens, especially the challenged population. And thank you for being here. And
No, thank you for being an advocate for many communities across the state, and hopefully we will reactivate that board.
Thank you.
Abdullah,
Appreciate
closing remarks for you.
Yeah, closing remarks. Thank you so much for having me on here today. The only thing I ask for is people to stay engaged, to stay involved, to stay in tune, to stay connected. If you have any questions, feel free to reach out to my office. We're always welcoming to any ideas. If you have a different perspective with our ideas, we're happy to take them. Oh, wow. Happy birthday to you. Happy birthday to Hussein. Happy birthday to you. حلوة. مش عارفين يوم birthday طبعا.
What's up, baby? How are you? It's all right.
بتخلص.
Crashed it. Hang it in.
قال لي بتخرب لك الشو فرايداي. I'm like, شو بتخرب الشو؟ قالوا لي قفل. انا اصابي قفلت. عبد الله thank you حبيبي والله we love you man sorry about how you know that.
وفي كيك اختها الشغله معك. استاذ حسين انا بالنيابه عن كل اخواتي
تطلع على الكاميرا وين الكاميرا؟ وين الكاميرا؟ زينب قربي له الكاميرا.
بلا كاميرات بلا كاميرات.
عيادكم فتوا على اللايف يعني.
نحن الحقيقه ما كناش حابين انه نزعجك
لا
بس انه لحتى تكون المساله بحجم الحدث لازم يكون فيها شيء مميز. فزينب الله يوفق لنا اياها ويطولنا بعمرها ويخليكم لبعض حبت انه تعمل لك هذه المفاجاه. نحن كلتنا التزمنا باوامرها. نحن
حتى عطت تعليمات وين توقف السيارات.
وين بدها توقف السيارات. وعملت كل الاتصالات وصار المساله عم تحضر يعني اكثر من اسبوعين. صح. فعلى هذا الاساس
انت عارف كمان
بالنيابه عن كل الموجودين بدنا نقول لك انه بنتمنى لك عمر مديد طويل مليء بالمحبه والهنا والسعاده والنجاح. نحن جميعا فخورين فيك. انت في ناس بيخلقوا مره واحده، انت كل يوم في عندك ولاده. فبنتمنى لك انه عيد ميلادك يكون مليان خير وبركه، وبنشد على ايدك وبنقول لك حسين كفي بالطريق اللي انت ماشي فيه، نحن كلتنا معك.
هذا مش محضر ها؟ هذا مش محضر.
انت يعني شاب فتحت الطريق قدام كثير من الشباب. نحن مدينين لك بمدينه ديربورن، انك كنت من السباقين لحتى تجمع الشباب وتطلقهم من النادي اللبناني وصولا لاجوكير، وصولا لكل العمل الانساني اللي عم تقوم فيه انت وامريكانا وكل الشباب والصبايا خضر زاك الكل هون يعني بيشدوا على ايدك بيتمنوا لك كل الخير وكل النجاح الك ولزينب وللعرايس الصغار، وان شاء الله بتشوفهم باعلى المراتب يا رب.
I think we're concluding the show. This is Hussain's 56th birthday. Thank you so much for tuning in. Thank you much for having us. Ahmad and me, inshallah. Thank you all.
وين كان
بس
وين كانت الحلوة؟ وين كانت الحلوة؟